Why should liver disease be prioritized in measures aimed at addressing non-communicable diseases?
It is my pleasure to address you today to discuss chronic liver disease as an important public health threat in the United States. My name is Ray Kim. I'm currently serving as president of AASLD, the American Association for the Study of Liver Disease. Chronic liver disease is a leading cause of death. This is a recent paper that analyzed mortality statistics in the US. In 2019, just before the pandemic, chronic liver disease and cirrhosis was listed as number 11th cause of death. By 2023, it went up to 9th rank, highlighting the importance of chronic liver disease as a threat in terms of public health. I also need to emphasize that statistics did not include liver cancer, which is a part of the spectrum of chronic liver disease. Altogether, if you look back 20 years of data, there was a doubling in the number of deaths related to chronic liver disease. Within chronic liver disease, there are 4 categories that are captured here. The red, alcohol-associated liver disease. The orange, viral hepatitis. The green is other unknown categories, followed by metabolic dysfunction-associated steatotic liver disease. With the exception of viral hepatitis, you notice the impact has been decreasing in the recent past. Everything else has been increasing. AASLD's goal is to reverse this trend and reduce and ultimately eliminate chronic liver disease. As was just discussed, alcohol-associated liver disease accounts for 52% of liver disease deaths, followed by the green other unknown category, which we believe most likely include undiagnosed MASLD, as well as rarer forms of chronic liver disease, such as autoimmune hepatitis. Viral hepatitis, as of 2021, accounting for 5%, and its impact has been decreasing as a result of vaccination, screening, and antiviral therapy in infected individuals. That means the vast majority of chronic liver disease is in non-communicable form, and many of those patients will benefit from lifestyle changes as well as liver-directed therapy in appropriate cases. AASLD's approach for non-communicable chronic liver disease may be looked upon as 3 different components. The first is to engage systematic efforts to detect early-stage chronic liver disease so that patients will not progress to cirrhosis and further complications of CLD. Second, we want to engage scalable lifestyle interventions to the degree that most of our patients will benefit from those interventions. Third, we want to link individuals who are in progressive stages of liver disease so we can apply effective liver-directed therapy. Our specialty care in hepatology addresses the third component. The remaining work needs to be done outside our offices in terms of primary care practices, community settings, and the domain of public health. So if I can summarize the impact of non-communicable chronic liver disease in the US, chronic liver disease or CLD, including liver cancer, is a leading cause of death in the US. Non-communicable disease accounts for the vast majority of CLD mortality. Controlling and eliminating non-communicable CLD requires multidimensional collaborations. We just alluded to primary care, hepatology, and other specialty collaboration. Public health and clinical medicine need to be linked, as well as a government, public health programs, and private facilities working together. As we think about our way forward, we need to share the right knowledge, deploy sufficient resources, and corral the will of people and appropriate stakeholders. AASLD is committed to alignment and leadership so that we can be most effective in our efforts. Thank you very much.
How do the WHO's newly adopted Best Buys address risk factors that contribute to liver disease?
The World Health Organization published the first list of Best Buys already in 2013 and then updated them in 2023. This was approved by the World Health Assembly, the highest decision-making body for WHO, so it's made up of all of the member states of WHO. And the list of Best Buys and other recommended interventions is intended as a guide for countries to help implement the WHO Global NCD Plan. The focus is predominantly on 4 main NCD risk factors. These are physical inactivity, unhealthy diet, tobacco, and alcohol, and 4 diseases: cardiovascular disease, diabetes, chronic respiratory disease, and cancer. So this brings us back to liver disease. The risk factors I just mentioned, physical inactivity, unhealthy diet, tobacco, alcohol, are what we spend a lot of our time working on, either as a means of primary prevention of liver disease or in the treatment and care of people living with liver diseases. So some of the Best Buys are very aligned with our work in the liver community. Take, for example, those on alcohol, such as increasing excise taxes on alcoholic beverages and enacting and enforcing bans or comprehensive restrictions on exposure to alcohol advertising. These very much align with EASL's own policy recommendations. We can find similar alignment on other risk factors. It is, however, important to note that the explicit mention of the liver is very limited in the WHO Best Buys, only appearing in relation to hepatitis B immunization for cancer prevention. MASLD, MASH, NAFLD, NASH, for example, are not mentioned even once. So as a community, we have 2 clear asks for WHO. Firstly, liver disease, and especially MASLD and MASH, should be explicitly mentioned within the Best Buys and across all NCD strategies and action plans. This is a relatively easy ask. The second is we need WHO to fill the dearth in technical guidance. This could initially be a technical brief on MASLD and MASH, similar to what they've done on diabetes, heart disease, and other therapeutic areas.
What current developments in the liver health field are being raised at the upcoming UN high-level meeting on non-communicable diseases, and what stakeholders are involved?
During the United Nations General Assembly meeting in 2025, the 4th high-level meeting on NCDs will take place. The HLM represents an important political moment that will help to set and guide the NCD agenda for the years ahead. Throughout next year, countries will come together to negotiate a political declaration for adoption at the HLM, and this will set out the commitments and ambitions for countries. In advance of this, in September, just last week, we held the first ever United Nations General Assembly side event, specifically focused on MASLD and MASH. This was done in collaboration with the Economist Impact and various partners. It was endorsed by the Healthy Lives Coalition, EASL, AASLD, ALE, Apostle, and SOLDA, created to raise awareness about liver diseases. We had the Minister of Public Health of Qatar, the incoming Health Secretary from Mexico, and other leaders in the field of liver health and NCDs meeting in New York to discuss these kinds of key issues. So both of these individuals clearly pushed for regional cooperation and collaboration with bodies like WHO to elevate liver diseases as a key public health concern. Qatar and Latin American countries were noted for setting ambitious national health goals that integrate liver disease screening. Now, the overriding themes and messages during the event included holistic health and policy integration, including integrating MASLD and MASH into existing non-communicable diseases, policies, action plans, strategies, even technical guidance, integration with other disciplines, raising awareness, and policy advocacy, including the 3 E's of economic arguments, emotional appeal, and evidence based on science. And we went through some of the barriers to progress, the lack of awareness among healthcare providers and the public and policy and decision makers more generally. Through the collaboration with The Economist's Impact, we also produced policy briefs for Germany, Japan, and the US with specific calls to policymakers in those countries. And currently, we're exploring options at the Barcelona Institute for Global Health to produce another policy brief for Spain, to continue this series, to hold discussions at the Global Think Tank on Steatotic Liver Disease, and to keep the pressure on governments, both at the World Health Assembly and at the UN General Assembly, to address the MASLD and MASH public health threat.